Every study of the outpatient use of one particular drug, hydroxychloroquine, with or without accompanying agents, has shown substantial benefit in reducing risks of hospitalization and mortality. Such a drug must be safe, and it must be safe when used in the initial viral replication phase of this illness. We know this from common sense.
Now, as COVID cases skyrocket, health experts are still dismissing the potential benefits of prophylactics, the front-end treatments like the one Dr. Harvey Risch just mentioned. In fact, during that same Senate hearing, Dr. Ashish Jha, Dean of the Brown University School of Public Health and MSNBC favorite, launched this attack on the drug hydroxychloroquine.
Every single high-quality study has failed to find any benefit of hydroxychloroquine for COVID-19. But authorizing therapies due to political pressure or with little to no data does far more harm than good.
Dr. Harvey Risch, epidemiology professor at the Yale School of Public Health, joins me now. Dr. Risch, the political pressure that has been brought to bear against hydroxychloroquine is coming from the medical establishment, which from day one wanted to squash it. Why?
Well, it's unclear, but I think there's a pair of factors that comes into play. I think both include that it's cheap, it's inexpensive, and it already exists and it's already approved. And on a fair marketplace, it will dramatically outcompete expensive medications. And the second is that once the president said something about it, it was already untouchable.
Well, Dr. Risch, this is what Dr. Jha said about following the science for his patients.
I think a lot about the evidence. I think that my patients want me to give them science-based treatments. I do take care of patients, and I try to do my best by them. Obviously, I'm not perfect, but I try to use science as well as compassion to guide me.
We appreciate that. Have you treated any COVID patients?
I have not, sir.
Well, he hasn't treated a COVID patient. Dr. Stephen Smith, who runs the Smith Center for Infectious Diseases in New Jersey, he's been on the show, I can't even count how many times since March. He's treated over 300 patients, and before it was verboten, he saw great success with hydroxychloroquine, and he couldn't peg it to any other possible intervention, Dr. Risch.
That's correct. And Dr. Farid and Dr. Zelenko and Dr. Tyson and Dr. Proctor, everyone who has come forward to say that they're actually using it shows dramatic success with this.
Now, CNN, Dr. Risch, thinks that hydroxychloroquine is to blame for Americans being so hesitant about a COVID vaccine.
4 in 10 Americans remain unwilling to get a vaccine. What's your message to those people?
Well, I know the reluctance and the hesitation because of the concerns of how the FDA was issuing these emergency use authorizations. Hydroxychloroquine was an example of where an emergency use authorization was granted for something that really didn't have any evidence behind that.
First of all, Dr. Risch, they didn't need an emergency use authorization. That was a screw up by the FDA. The drug's been around for almost 70 years, and you could use it over, for other maladies. A doctor can, because it's so safe.
Yes, and in fact, the first emergency use authorization was actually a restriction that Rick Bright was insubordinate. He was ordered to make an investigational new drug application, and he didn't. He conspired to make an emergency use authorization and put a limitation on the use of it to hospital patients only. And that was passed in a half an hour in the middle of the night by the FDA, and that spent some months before it was revoked because it was only for severely ill hospital patients where it's already too late to work. So it was the exact opposite.
Right, and the studies that Dr. Jha kept citing are studies invariably when it was used too late or not at the right dosing, according to Dr. Didier Raoult, who's a renowned epidemiologist himself. Dr. Risch, thank you for your courage and your wisdom in speaking out on this. And we enjoyed the testimony yesterday very much. Thanks so much.
Thank you very much.